Do your joints hurt when you wake up in the morning?
Do you feel stiffness, swelling, or pain while walking, sitting, or even resting? Many people ignore joint pain until it becomes a serious problem. In today's video, we will talk about 5 major joint diseases, their causes, symptoms, and treatments, so you can protect your joints and live a healthier, pain-free life. Number 1. Osteoarthritis. Osteoarthritis is the most common joint disease in the world. It is a degenerative joint disorder, which means it develops slowly over time as the joint wears out. In a healthy joint, the ends of bones are covered with smooth cartilage that allows easy movement. In osteoarthritis, this cartilage gradually breaks down, causing bones to rub against each other. This leads to pain, stiffness, swelling, and reduced movement. Osteoarthritis usually affects weight-bearing joints, such as the knees, hips, spine, and feet, but it can also affect the hands and shoulders. It is more common in older adults, but younger people can also develop it due to joint injury, obesity, or genetic factors. Common symptoms include joint pain during or after movement, stiffness especially in the morning or after rest, swelling, and a cracking or grinding sound when moving the joint. As the disease progresses, joint deformity and muscle weakness may occur. Treatment of osteoarthritis. There is no permanent cure for osteoarthritis, but treatment focuses on reducing pain, improving joint function, and slowing disease progression. Pain relief medicines such as paracetamol and non-steroidal, anti-inflammatory drugs, NSAIDs, are commonly used. Physical therapy plays a very important role by strengthening muscles around the joint and improving flexibility. Weight loss is strongly recommended for overweight patients to reduce pressure on joints. Heat and cold therapy can help reduce pain and stiffness. In severe cases where daily activities become difficult, joint replacement surgery such as knee or hip replacement may be advised. Number 2. Rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that mainly affects the joints. In this condition, the body's immune system mistakenly attacks the lining of the joints, known as the synovium. This causes inflammation, pain, swelling, and eventually damage to the joint structure. Unlike osteoarthritis, rheumatoid arthritis can affect people at any age and is more common in women than men. It usually affects joints on both sides of the body, such as both hands or both knees. Over time, rheumatoid arthritis can also affect other organs like the heart, lungs, eyes, and blood vessels. Symptoms include joint pain, swelling, stiffness, especially in the morning lasting more than 1 hour, fatigue, fever, and weight loss. If untreated, the disease can lead to joint deformity, disability, and reduced quality of life. Treatment of rheumatoid arthritis. Early treatment is very important to prevent joint damage. The main treatment includes disease-modifying anti-rheumatic drugs, DMARDs, such as methotrexate, which slow down the disease progression. Biologic drugs are used in more severe cases to target specific parts of the immune system. NSAIDs and corticosteroids help reduce pain and inflammation. Physical therapy helps maintain joint movement and muscle strength. Lifestyle changes such as regular exercise, stress management, and a healthy diet are also important. In advanced cases, surgery may be needed to repair or replace damaged joints. If you are serious about improving your health and learning simple habits to protect your joints, make sure you subscribe to this channel and stay connected with healthy habits. Number 3. Gout. Gout is a type of inflammatory arthritis caused by the buildup of uric acid, crystals in the joints. Uric acid is a waste product formed when the body breaks down substances called purines, which are found in certain foods. When uric acid levels become too high, crystals form and deposit in the joints, causing sudden and severe pain. Gout most commonly affects the big toe, but it can also affect the ankles, knees, wrists, and fingers. Gout attacks often start suddenly, usually at night, and can be extremely painful. Symptoms include intense joint pain, redness, swelling, warmth, and tenderness. The affected joint may become so painful that even light touch is unbearable. Repeated attacks can lead to chronic gout and joint damage. Treatment of gout. Treatment aims to relieve pain during attacks and prevent future episodes. During an acute attack, NSAIDs, colchicine, or corticosteroids are used to reduce inflammation and pain. To prevent future attacks, medicines such as allopurinol or febuxostat are prescribed to lower uric acid levels. Lifestyle changes are very important, including drinking plenty of water, avoiding alcohol, reducing intake of red meat and seafood, and maintaining a healthy weight. With proper treatment and lifestyle management, gout can be well controlled. Number 4. Septic arthritis. Septic arthritis is a serious joint infection caused by bacteria, viruses, or fungi. It occurs when germs enter the joint through the bloodstream, an open wound, or during surgery. This condition is considered a medical emergency
because it can rapidly destroy the joint if not treated promptly.
Septic arthritis commonly affects large joints such as the knee and hip. It can occur in people of any age, but is more common in infants, elderly individuals, and people with weakened immune systems. Symptoms include severe joint pain, swelling, redness, warmth, fever, chills,
and difficulty moving the affected joint. The pain usually worsens quickly over a short period of time.
Treatment of septic arthritis. Immediate treatment is essential to prevent permanent joint damage. The main treatment is antibiotic therapy, usually given intravenously at first.
Joint fluid is often drained using a needle or surgery to remove infected
material. Rest and immobilization of the joint are recommended initially,
followed by physical therapy once the infection is controlled.
Early diagnosis and treatment greatly improve the outcome. Number 5. Ankylosing spondylitis. Ankylosing spondylitis is a chronic inflammatory disease that mainly affects the spine and sacroiliac joints. Over time, inflammation can cause the vertebrae to fuse together, leading to reduced flexibility and a stooped posture. This condition usually begins in early adulthood and is more common in men. Symptoms include chronic lower back pain, stiffness that improves with movement, fatigue, and limited spinal mobility. In severe cases, the chest, hips, shoulders, and even eyes can be affected.
If untreated, ankylosing spondylitis can cause permanent spinal deformity.
Treatment of ankylosing spondylitis. Although there is no cure, treatment focuses on controlling inflammation, reducing pain, and maintaining posture and mobility. NSAIDs are the first-line treatment for pain and stiffness. Biologic medicines such as TNF inhibitors are used in moderate to severe cases. Regular exercise and physical therapy are
extremely important to keep the spine flexible and prevent deformity. Good posture habits and breathing exercises are also recommended.
In rare cases, surgery may be needed to correct severe joint damage.
Don't forget to subscribe and turn on notifications,
because one healthy habit today can save you from pain and disease tomorrow. Joint diseases can
greatly affect a person's daily life if not diagnosed and treated properly.
Early medical care, proper medication, physical therapy, and healthy lifestyle choices can significantly improve outcomes. Understanding these conditions helps in better prevention, management, and long-term joint health.